The pediatric community woke up this morning to a new message from the Centers for Disease Control, a revisionist history, if you will, by revising the agency's stance on autism and vaccines. Right at the top of their vaccine safety webpage, they posted this. The claim vaccines do not cause autism is not an evidence-based claim because, well, studies have not ruled out the possibility that infant vaccines cause autism. The page went on to say, because autism spectrum diagnoses have increased since the 1980s, right about the time infant vaccines also increased, it would be a shame for the scientific community to rule out this, quote, potential contributor. It did mention one study that looked at aluminum in vaccines and the rise in autism spectrum diagnoses. Then, while admitting correlation does not prove causation, that doesn't mean we shouldn't study it any further, according to the website. And then the website of the CDC falsely claimed studies showing a link between vaccines and autism have been, quote, ignored by health authorities. Except they haven't, according to the American Academy of Pediatrics. Since 1998, independent researchers across 7 countries have conducted more than 40 high-quality studies involving more than 5.6 million people. This is according to the president of the American Academy of Pediatrics. That's a lot of studies. That's what they said, across 7 countries. The conclusion is clear and unambiguous. There's no link between vaccines and autism. That timing, that date in that statement, by the way, since 1998, is important since that was the year of the Lancet study. They released a study that alleged a link between the measles, mumps, and rubella vaccine and autism. Of course, that information scared a lot of parents, but that study was debunked and retracted 12 years later because of incorrect data and manipulation of that data. So this reversal by the CDC, which is under the RFK Jr.-run Department of Health and Human Services, just revives that debunked study. And apparently the change was made to the surprise of many CDC scientists. So we decided to ask a local scientist, a pediatrician with more than a dozen years of treating patients, to find out what he thought of the claim, vaccines do not cause autism, is not evidence-based.
It's like such an unhinged statement in its very face. You know, it says like that the statement that vaccines don't cause autism isn't evidence-based because it can't be, you know, it is not ruled out, is exactly the opposite of how we think of evidence-based claims. Proving something hasn't happened or proving that there isn't a link is not how we think of these things. We look for links and we don't find it. We don't try to make positive rule outs or positive proof of a lack of something. That's just not how things go. So when I see that, I think, no, this isn't a scientific statement. This is a political statement by a group of leaders that have an agenda and a narrative that they want to push.
I'm sure you've answered these questions over your career.
So many times, right? You know, because vaccines are this thing that is so important to the health of our children, and they prevent all these bad illnesses. But it's this thing as a parent that you have to do to your child that can make them uncomfortable. We could work with families and we could talk them into, we could lay out the evidence, we could show how important it was to prevent these illnesses. To have now to be fighting this uphill battle against like leaders of our health secretary and now the CDC, where they're like actively, you know, undermining the trust that we have in our institutions and in these tools that we have that are here to make kids healthy. It's just so disheartening, and it's frustrating, and it makes us so angry, and it makes our job just so much harder. And we rely on the CDC, you know, people trust it. These institutions that we have that we're eroding our trust in, they're important to us all. And so now to have to, you know, parents have to now what? They'll have to go to the CDC, they'll have to see what the American Academy of Pediatrics and the AMA and other groups of doctors say, and now they're gonna be confused. They're gonna think that, well, on one hand, these people say this, on the other hand, these other people say that, and they're not gonna know what to think.
Do you agree with the statement by the AAP saying anyone repeating this harmful myth is misinformed or intentionally trying to mislead parents?
Yeah, and that's where I agree with what the AAP is saying there. And there's those two categories. There are a lot of people who are, they're more of a victim of disinformation, but there's a small group of very successful people who are spreading disinformation. They have an agenda. and they have decided that vaccines are not good, and they want to sow doubt. They would like to take away the vaccines that we have, and if they're successful and more successful than they already have been, it's going to lead to a lot of kids getting a lot of vaccine preventable illnesses. Right now we can just prevent them. They would be completely needless illnesses, hospitalizations, and deaths that can occur from these illnesses.
Notice the asterisk following the vaccines do not cause autism header on the CDC website we showed you previously. It's carrying a lot of weight. That was to tell people they had to leave that statement on their website as part of an agreement to name RFK Jr. as the health secretary. But that obviously didn't stop all the other unsubstantiated stuff they put out there. We did receive a statement today signed by nearly 4 dozen organizations, from the American Academy of Pediatrics to the Autism Science Foundation to the Task Force for Global Health. They rejected this, quote, latest attempt to create fear around routine childhood immunizations, some of our greatest medical success stories. Together, they said, they call on the CDC to return its long history of promoting evidence-based information in the service of protecting the health and well-being of all Americans. As always, if you are a parent of young children and you have questions and concerns about vaccines, please consult with your pediatrician, because it's clear you're not going to find a consistent answer online.